If I'm doing coronal, that means I'm coming all the way lateral, okay? And I'm going to see the kidney more like horizontal. I kind of do it like this, right? If I'm coming sagittal, take a deep breath. You're ribby. Sagittal will be a little bit more even, I guess you'd say, like the cortex, even versus coronal. You'll notice that the lateral part is a little thicker, okay, when I come more lateral. So I really want you guys to work on obtaining the kidney more lateral, you know, which is going to be a coronal approach. So your scanning plane will be coronal if you come all the way lateral. So you should have coronal, definitely which kidney, right? Or breathe normal? Are you breathing?
I just
Okay. Yeah, just breathe normal.
Okay.
Coronal, right kidney, and then supine, or if you roll your patient, a decubitus, left lateral decubitus, tell me that, because you often will use a decubitus position if you're struggling seeing this inferior part, right? Because there's gases often inferior that will cover the inferior pole. So take a deep breath and hold it. So if they take a deep breath and it helps you see that inferior pole, that's great. That's going to be a great technique. If it's still covered, sometimes you'll see like half of the kidney covered, then breathe normal. Then don't be afraid to roll your patient decubitus. Then those gases will kind of fall medial and you should be able to see that inferior pole a little bit better. Okay, so if you're scanning the kidney in a coronal plane, then when you rock through the kidney, think of coming coronal. Okay, so from the lateral aspect. If I'm rocking through the kidney, I'm seeing the anterior and the posterior parts of the kidney. Okay, if I come anterior, when I rock through the kidney, I'm seeing medial and lateral. Okay, so depending on what plane that you're using will depend on how you label your, as long as you label correctly, I don't care which approach you use, if you use coronal or anterior. I prefer for you to try and do coronal first and obtain it that way, because that's probably the most common way you'll see kidneys, and you'll be able to really visualize the pelvis the best coming from a coronal plane. But if I'm coming coronal, when I scan through, that's anterior, mid, and posterior. If I'm coming, take a deep breath. If I'm coming more sagittal, medial, mid, lateral. Okay, so I'm just gonna breathe. I'm gonna label that accordingly. So on your sheet, it might help if you put like a line or something next to anterior, or put sagittal at the top. If you're sagittal, anterior is equivalent to medial. If you're sagittal, posterior is equivalent to the lateral aspect. Okay. In the PowerPoint that I made, I have two different ones. I have a coronal one and I have a sagittal one that can kind of show you the difference. So for your long view, you've got, you're gonna have 4 measurements. You're gonna have the anterior, posterior measurement, and then the length for your long view. And then in transverse, you have the width and also another AP measurement. So you'll have 2 AP measurements that should be pretty similar to each other, okay? And that's just for you guys to practice taking measurements. As far as which one is the golden standard, it kind of just depends on where you work and how they like you to do it, all right? And then when we get to transverse, we're gonna sweep all the way upper pole, or you can use upper, mid, or lower, or you can use superior, mid, or lower. Okay, if you're in the renal setting, there should be a tab that you just press and it goes through all of them. All right, so I'm gonna get started. I'm gonna come here, take a deep breath. And I like, before I start just snapping pictures, I'm going to rock through the kidney anterior to posterior and kind of twist my probe to get the length as long as possible. So I'm gonna, oh, anterior's the first one. So there's kind of my long view, and then I'm gonna rock anterior here. Notice how when I'm anterior, this cortex here, I see a break in the cortex. So like a long axis, it's all connected. When I go anterior, I kind of lose this cortex connection, and I see the hilum here. These are the renal vessels, okay? So what I want you to focus on is when you rock, is that it's equally shorter. So I don't lose one pole or the other pole. It just equally gets a little smaller. And you do that by that fishtailing the probe. So if I take a deep breath. If I'm oblique, see, that's oblique. I missed this whole superior part. I have to twist the probe and then rock. So see how it's more even? Breathe. Here's superior, here's inferior, but it's not as long as it is for the mid. Okay, so you're gonna see the hilum when you're angled anterior, and you'll see the hilum when you're also medial from an anterior approach. Okay, so when you're rocking through the kidney, say I have my long axis and I'm scanning the kidney here, and I'm going anterior to posterior. It's not always an exact science once you find the long axis. You can't just go forward and go backward. It's gonna vary on everyone. So sometimes I'll say, in order to go anterior, you have to move anterior. In order to go posterior, you have to move posterior once you find the long axis. Some patients, you can find the long axis and then just rock anterior, rock posterior. Others, it's like there's no tissue there to scan. So in order to go forward, I actually scoot posterior and then rock through. It's like there's no tissue to scan through. So you have to go all the way to the back to scan all the way forward and angle the probe. Or to go back, I gotta go all the way forward to go all the way back. Is that making sense? So I'll show you guys what I mean by that. I'll try and show you. Take a deep breath. Okay, so here is a long axis right in here, okay? See how the poles are pretty long and equal distance? I'm just rocking anterior. So I can rock anterior and see pretty well on Kimberly here, or I can go back and then rock all the way through. So I went posterior to go anterior, or anterior to go posterior. All right. Once you guys start scanning it, you'll understand kind of the concept, because sometimes you lose it. All right, so here would be a good long axis. Before I commit to a measurement, I will usually put my calipers on superior to inferior here. I can kind of see it coming down here, 11.8. What's a normal measurement for kidneys?
9 to 12.
9 to 12. So if I'm within that range, I'll make a mental note and say, okay, that's 11.8. Maybe save it. Here would be your second measurement. And I also like to put the caliper lines on when I'm doing the measurement so you guys can see that it's actually perpendicular to each other. So I might save this picture and then I'm gonna try one more time and see if I can reproduce it or get it longer. Take a deep breath. Hold it. So I'm just kind of rocking the probe. Breathe. And I'm gonna put my calipers, see if I get that the same. So the other one was actually a little bit longer, so I probably would go with the other one, 11.8, 11.3. And if I'm getting really large discrepancies, I might try a few times. So don't be afraid to just put your calipers on and see, like if take a deep breath and hold it. If I have something like this, breathe, and I put my caliper on, I'm gonna say, okay, it's still 10 centimeters, but the shape of it looks, doesn't look equal, right? So if I kind of look here, it's mainly cortex. So generally speaking, you're gonna have a pretty echogenic sinus that should be in the center part. Kimberly has a pretty thick cortex. She's got really nice healthy kidneys here. So you'll see a variation on some patients just depending on how thick their cortex is and how far it extends into the sinus. All these little anechoic spots, what are these? Pyramids. And then if I look here and angle anterior and I see anechoic, what is the first thing I should do to determine, is that fluid? Is there hydro in the pelvis, or are there vessels?
Color.
I'm gonna put my color on. And see how that's all lighting up there? So those are her vessels. Except for maybe that one there. Let's see. Nope, that lights up too. It was just my angle. So don't be afraid to put your color on just to help you verify vascular and non-vascular structures. Okay, so I showed you anterior, that has the pelvis, where you see the vessels and a break in the cortex in the, in the medial side here. And then post long axis, we're gonna see, as long as possible, between 9 and 12 centimeters. And, again, it should be point to point, pretty equal distance. If you kind of see it one side shorter than the other, then you need to kind of fishtail your probe a little bit, all right? And then posterior is going to be mainly cortex. Take a deep breath and hold it. And it still gets shorter when I angle posterior there too. So this is a posterior aspect here. So practice going all the way through the kidney and then coming back out. There would be long, there's anterior, mid, and posterior. So this is mainly cortex. When you're on the posterior or the lateral aspect, you're mainly gonna see the cortex. And then for the right side, we've got kidney liver interface. This should look exactly like what you guys show me when you did the liver. Okay, so I want to see the liver all the way to the diaphragm. I want to see Morrison's pouch. Most likely you're going to be more of a sagittal plane, and that's fine. I understand that. So at least half of the image should be liver here to the diaphragm, and I can see Morrison's pouch and a crisp interface between the two. So that's the kidney liver interface on the right side. All right, I'm gonna go to transverse. Transverse, I like to start more of an anterior approach on transverse, and then move lateral based on how well I see or don't see. Because I wanna use the liver, take a deep breath. So for your upper pole, here's all liver. I'm gonna start angling down and see her little circle here coming in. And I'm actually going to decrease the sector size a little bit on her because this probe is pretty large. So if I start to see the hilum here, I'm too far mid. It should be like a little circle. Breathe. So depending on the shape of their kidney and how much sinus they have, how prominent the sinus is, will depend on what this looks like. I want you to practice going all the way superior, all the way inferior, all the way upper pole, all the way lower pole, depending on what term you want to use, or what label. But it looks like just all cortex, very circular. If I am oblique on the kidney, then take a deep breath. It's gonna look like this. And I don't want that. I want it to be truly axial. So it's generally pretty round. There's upper pole, starts to peek in. Then I start angling, and my chompers, I call them, my little Pac-Man chompers, I want those to be equal. I don't want one to be longer than the other. See, like that would be longer, or that would be longer. I want both little chompers there to be pretty equal. Breathe. What's this right here?
Muscle.
What muscle? Probably both quadratus lumborum and psoas. Okay, so psoas is going to be more medial, quadratus lumborum is more lateral, but they're both posterior. So don't let that muscle fool you. We can see a nice interface here, but often they're isoechoic to the cortex. So you don't want to overestimate your measurement and include that. So the kidney's going to be pretty, I guess you'd say, like round in its cortex. If I'm looking at the cortex here and I'm following it around, it's like I said, it's not going to be like this or like this. It's going to be pretty even. And I can see the hilum here. There's a break. So this would be where my mid pole is. This is where I'm going to do my measurement. Now on Kimberly, I can see the hilum very horizontal. It's just because I'm anterior on her body. If I start to move my probe lateral, okay, I'm going to watch my hilum start to move at different angles. If I'm completely lateral, my hilum is going to be down because this would be lateral to medial. If I'm slightly at an angle, in between completely, lateral and anterior, I might see it like this. And I'll show you guys the difference. Let me show you how to measure this. So I do an imaginary line, like if I were to connect this end of the cortex to this end of the cortex. I like to start with this measurement first, then go all the way out lateral to the cortex here, and then my second one is going to be perpendicular to that. So do your mid measurement with the hilum first, and that way you don't give me all these I start to get all these funky measurements like this. Right? Okay. So they should be perpendicular to each other. You should have an acute angle when you do your measurement. Now like I said, her hilum is horizontal. So that's why I went straight across and straight up and down. But if I move lateral, take a deep breath. So I'm slightly lateral here, but my chompers are still even. So I'm going to start from here and go lateral part of the cortex, and then I'm going to do perpendicular to that. Can you guys see the difference? I don't want to see this. Okay, so go parallel to where the hilum is and go straight back wherever you see the hilum. You'll find some preceptors will say, what are you measuring here? It's just an opening. We're doing like an imaginary line. So they might like you to do the just cortex like this. But, unless somebody says something to you, it's the same thing. Okay. Generally, I like to start in the center just because the cortex usually extends a little further out on that lateral part. So you get a little bit more accurate. If I come all the way lateral, hers is very, I'd have to be very lateral. You guys can see the hilum coming down here. See this little? So on Kimberly, her transverse is way easier to use the liver. Take a deep breath. I'm going to do that again. So here's upper, mid, and I'm going to go all the way lower, all the way out, and come back up. And there's the lower pole. We can see a little bit like a donut hole here, the sinus, but it should be very round, and the cortex should all be connected for the lower pole. Or you can go, all the way out like such. So one thing to consider is if you're in a long plane and the inferior pole is covered by gases, you might have a hard time going all the way inferior because you're going to see gases. So you kind of have to reference how easy or hard it was when you got the long plane. And I can, for your long view, you want to keep your sector wide open. For your transverse, just depending on how much extra space you have on the side, you can always decrease that sector size slightly there. Kind of like what I told you guys with the gallbladder in transverse. All right, but don't make it so small that you lose perspective. And then the last one in transverse is going to be the hilum with the renal vessels. So if you can, on the right side, often you can see the renal vessels very clear in 2D. And if you see them clear and they're nice and anechoic, take a deep breath. You can show them to me just, 2D, like such, okay? So I want to see the vessels at the hilum. I don't want to see just these vessels here, intra-renal. I want to see the renal vessels here entering and exiting the hilum. So it's going to be at the level of the mid kidney and transverse. If you can't see them in just 2D, take a deep breath. Then you're welcome to put your color box on. We might have to come at a little bit of a different angle there. And then you can show it to me with color flow. Okay, so it just depends on how well that you actually will see. And we see hers pretty nice in 2D, so 2D would be acceptable. All right, so we're gonna do the same thing on the left side. All right, I'm gonna start by reaching over and seeing how well I can see with her supine, but for the most part, you guys will notice that you wanna, wipe that up.
More wet than
You often, especially in lab, you guys can have your patients roll towards you, right lateral decubitus, and then you're using better ergonomics, and you're not having, not everybody looks like Kimberly, right? So you have these big patients and you're trying to reach over and it's hard. So if they can move, have them roll towards you. I'm gonna kind of reach over and look for her left kidney here before I make her roll. Did I lose all my gel? Take a deep breath. So her kidney's pretty low here. All right, so roll towards me. And if you notice, often when your patients roll, especially females, there kind of becomes like that natural indention where basically like your waist, and often the kidney kind of lies there. So if that happens and you get stuck and you're losing part of the poles, you can, while you're scanning, you can ask your patient to stretch that arm. See how it opens up? But they can't stay that way, right? But you might ask them to stretch real far just to get a certain picture. It kind of opens up your scanning window. You can relax. Another technique that you can use if you're really struggling with kind of your probe being stuck in that little indention is to have a rolled towel or a rolled pillow or something, have them, lift up, scoot it under or sit up, put it there and have them lay on top of it. And that's naturally going to open up that space for you. Okay, and I can, we can use that technique accordingly with some of you guys when we start to scan, when you guys are scanning. Take a deep breath and hold it. So I'm gonna look around and find my best window. There's the spleen. And I'm gonna come a little further posterior on her just to see if that superior pole. Hers are a little pretty oblique lying. So I'm really having to twist my probe to get the pole in there. Breathe normal. I'm gonna come a little further posterior. Actually, let's try like this. Take a deep breath. So breathe normal. So you can tell the left side is a little more challenging than the right side. It's just because remember the left kidney's higher, so you're dealing with the ribs. So it's not uncommon for you to have like a shadow, especially superior here to get inferior, or for the contour or the echogenicity be a little bit fuzzier because you don't have that liver as a good acoustic window often that you see on the right side. So the left side is going to be a little bit more challenging. So it looks like I'm going to have to use multiple windows to demonstrate anterior and posterior. So take a deep breath and hold it. I'm gonna come actually a little bit more posterior and angle anterior. Remember how I said I needed to go back to go forward? And breathe. So here is my cortex. This is inferior, this is superior. Notice here it gets a little fuzzy, it's not as prominent. I'm angled towards the front, anterior, okay? So this would be the hilum. That's that kind of break in the cortex. All right, so this would be my anterior image, long axis. I could see those poles a little better. Take a deep breath. So I'm gonna go back to where except for her inferior pole is a little tricky there. Breathe. So here's superior, and there's the inferior pole. So 11.65, that's very close to what I got on the right. So always make that mental note of the measurement on the contralateral side because they should be similar. Hers was 11, I got 11.3 to 11.8. So if I got a 9 centimeter kidney or a 10 centimeter, I'm gonna go, okay, I probably don't have it as long as possible. They should be pretty symmetrical in their measurements. And I'm gonna follow this along all the way down to here. I kind of lost that cortex, but I could see the superior part pretty nice there. So that would be my long axis. And then posterior is gonna be all cortex. See how it's all cortex here? I'm still getting it in a long view. I'm not gonna, when I go posterior, take a deep breath. I'm not gonna twist my probe so oblique that it looks transverse or kind of between the two. I'm gonna go and try and keep the poles as equal distance as possible there. You look like you have a little hydro. See
I
that?
tried to use the restroom, but I don't know.
I was
if
gonna
that would
say,
go up.
well,
It's not high yet or anything.
so if you have a patient that has mild hydro, kind of like this, I would have them go empty their bladder, say, do you need to use the restroom, right? Have them go empty their bladder and then scan again, and usually it goes away, okay? So I would predict if she went and emptied her bladder, we wouldn't see those calyces or the pelvis filled as much as we do on this left side here, which is fine. That's a great demonstration for you guys to see. It really was anechoic. The vessels can be very prominent, but I'm gonna confirm by putting my color on, coming from different windows. It never lights up, so it's definitely hydro. Okay. Okay, so posterior, and then we're gonna do a spleen. Just like we do a kidney liver interface, we're gonna do a spleen kidney interface. So the spleen is a little higher. And not everybody's spleen and kidneys are friends. I call them friends when they're close to each other. Sometimes the kidney's much lower and they're just acquaintances or not even good acquaintances. They're kind of far and it's hard to like really show it. I saw that initially, her spleen, so they're friends. Take a little breath. So I'm gonna move a little bit higher. Find the spleen and then angle posterior there. See how I can see a nice little window. And that might be the best I can get for now without that rib. And this would be acceptable. So spleen, kidney. Okay, you're gonna see this again when we go to the spleen. You'll do a spleen and a left kidney interface. All right, now we're gonna move to transverse. And I want you to think about, take a little breath and hold it. Let me show this. I know this isn't a good window here, but I just wanna show you guys anatomy. Breathe. So this is superior, this is inferior. We're in a long plane. When I look at the kidney behind this big shadow, this is the kidney here. This is my superior pole, this is my inferior pole. What's closest to the superior? The spleen. So when I go transverse, I'm gonna go as high as possible. I'm gonna look for the spleen, and then when I start to come inferior, the first part of the kidney that I see, that's gonna be your upper pole. All right? Usually if you go transverse and you find something super simple and quick, you're probably on the inferior pole because that's the easiest pole to get on the left side. Notice how there's not as much gas. You're not dealing with the ribs because you're coming lower. So be sure that you're scanning all the way through in an axial plane. So I'm actually gonna come up in a transverse view. I'm losing a little contact there. Sorry, I'm gonna gel you up a little bit more. But we're gonna do spleen too, so I'm gonna put a little more gel. So here is spleen. See my kidney popping in and out, looks like a circle. I'm gonna decrease my sector a little bit. And I'm actually just using her normal respiration for it to come into my field of view. So a lot of times with the kidneys, if you just are patient and keep your probe where it needs to be and don't even say anything to them, let them do their normal respiration, it comes to you, okay? Or you can ask them to hold their breath. But often that just little movement, if you're quick with your fingers. So here is my upper pole. See this little circle, all cortex. Now I'm probably gonna have to move to a different approach for my mid because there was a lot of gases and ribs covering that. So I came more posterior. Take a deep breath. Breathe. So you can see my little chomper here is at an angle. Okay, now I want you guys to think about orientation for a minute. On the right side, we saw the hilum medial, right? When we're anterior. And when we move lateral, it starts to come like this. So if I'm on the left side, more anterior, my hilum will be this way, my opening, right? Think of your kidneys like this in the body. So the opening should go towards each other. So when I start to move lateral on the body, it comes from here and the opening starts to go like this, down. Why is my hilum slightly pointed the opposite way?
Because you're more posterior.
Perfect, I'm more posterior. So if I'm posterior, then my hilum is going to be the opposite way. So either you have your probe light or notch the wrong way in transverse, or you've moved posterior and the hilum is going to be at a slightly different angle. If you use a posterior approach, then get in the habit of putting PA, posterior approach. All right, and that way they know that the notch is not backwards here. So I can see my little chompers are pretty even, and this is how I would do my measurement. I have an imaginary line here, going posterior, and then I'm gonna go perpendicular to that one, and that would be my measurement. Make sense? Yeah? I couldn't see hers very well anteriorly. Let's see, let me try one more approach here. There's another, this one's pretty good too. Can you guys see it there? So if I came anterior approach, here's my connection, my little chompers. I would come here to back here. And this would be, see how it looks completely different? All I did was go from posterior to anterior. Okay, so the hilum is more medial there because I'm anterior. Any questions about that? Okay, and then I'm gonna go all the way inferior, see my little circle there, or I could come posterior. Let's see, take a deep breath. Kind of like this little window for posterior. I'm gonna go all the way out, and there's posterior, or excuse me, inferior, our lower pole. See how it's completely circular? So when you are doing the hilum, you can always put your color box on to help you know that you're seeing the hilum there. See the vessels? So when I'm doing the last picture and I'm showing the renal vessels, I need to adjust my box and my my approach so I'm not catching the vasculature. And I want to be, that's hydro, the anechoic parts that aren't lighting up, but you guys can see the hilum coming in there. So this would be the renal hilum without the color. It's a little less prominent than what we saw on the right side. Remember how I said the right side, often in 2D you can see it pretty clear. It's a little less clear, so I'd like to use my color on the most often on the left side to see those renal vessels. All right, that's all for the kidneys.